Good morning, good day. Let's truly Professor Dr. Dolphy Gilpin here this morning. And we continue with some brief excerpts on anatomy and physiology of the body. And this morning we are on the specific area of the body, the skin. In medicine now we study dermatology. So we're on the skin as an organ. And this is one of the three organs that has caused great controversy in the earth. And as we name the three, the skin, the tongue is the order, and the skin, the tongue, and the vagina. In the Bible it is said about the tongue, "O greater fire, a little matter kindleth." And also in some scholarly literature, it is deemed the vagina, "O greater fire, a little matter kindleth." And the skin, if we should scrape the skin, the surface of the skin, just scrape it off. Whether you be black, white, or yellow or pink, and scrape it down, then I guess you scrape it down to the surface until it becomes red. But the surface here, which is the dermatology, the epidermis, with black and white, has caused great controversy, great wars, great racial discrimination and all. But anyhow, we are on medicine this morning, and let me just get into the basic anatomy here, with the capillaries on the skin, the subcutaneous gland, the ear, epidermis, the nerve, the dermis, the arteriole, the subcutaneous tissue, the fat collagen, the ear follicle, the sweat pore, the nerves, and so on. That's in the anatomy and physiology. If we spin it around here, spin it around, we're talking about some malignancy that occurs in the skin. And we have here dermatology, oncology in that field. We have the skin with the basal cell carcinoma, the melanoma, and the squamous cell carcinoma, which are the three most popular cancers of the skin, and the Merkel cell. This is a rarest form, but of lately it has becoming quite increasingly in popularity, the Merkel cell cancer. So we have the basal cell carcinoma, which is most common, the squamous cell carcinoma, which is said to take up about 20%, and the melanoma, which is most serious. And then we go on to another type of malignancy, like psoriasis, and this also, we have four basic psoriasis: the plaque psoriasis, the gouty psoriasis, the inverse psoriasis, and the pustular psoriasis. Right? These are serious malignancy that occurs through the skin, and some can even lead up to death. So very, very, very serious skin cancer. But all in all, they are very intolerable in terms of bearing and in terms of comfortability, and requires treatment as necessary. Let's just have a couple of okay, we have to spell that up temporarily. Yeah, so we have the basal cell carcinoma, squamous cell carcinoma, the melanoma, and the Merkel cell carcinoma, four cancers of the skin. And then we have another dangerous set of malignancy here down here, the psoriasis, of which we say you have the plaque psoriasis, the glutamate psoriasis, inverse psoriasis, and the pustular psoriasis. As usual, we're not going to all our solutions we have had in the form. All our solutions are in the form of electronic drug architecture, the IPC architecture, in which we have inscribed or we have drawn various drug solution, prescription drug solution, the architecture of it on bedside lamps or light emitting diodes, macro light emitting diodes. And so we have all of these. We have over 100 and something solutions here to medical problems, ranging from COVID, cancer, to all forms of problem, all the solution here, to the least, blood pressure. Blood pressure can be benign, moderate, or severe blood pressure. It's not really a killer, but it can cause great inconvenience and really interrupt the course of normal life. So here are the solutions. So the solution to our dermatology will be here. All the dermatology solution will be. I've drawn all these, take the patient and the time out to do it, but they are not in paper form or in the pharmacy prescription form. They are in electronic architecture. Electronic architecture. Like here's one, and some of these are in plain elements, like some of these are like nitrogen and oxygen. Oxygen is sometimes used as a solution to the sphenic. Let's put this here. This is also one. All our solutions are in electronic form. So once again, yours truly, Professor Dr. Dolphy Gilpin with dermatology and anatomy and physiology of the skin, and we have shown the four various cancer, psoriasis, and description of the epidermis, dermis, melanocytes, and so on from the skin.